guys, just wanted to jump on tonight and talk a little bit about shoulder impingement since I'm doing an overhead mobility workshop at CrossFit Rokius this coming Saturday. I thought it was timely to talk about some shoulder related stuff since impingement and mobility are very interrelated. So there's three things I generally look at when I'm looking for seeing someone with shoulder pain or shoulder impingement particularly. And the first is just kind of assessing their overall training volume. Usually shoulder impingement comes around when you go from not doing a lot of overhead work to suddenly doing a lot of overhead work, or whether there's a change in your training volume of a specific motion, movement, or something that places a lot of stress on the shoulder. So usually what I'll do there is I'll decrease the amount of stress then that you're placing on the shoulder. So if possible, try to ramp down that volume that you're doing. If you have a competition coming up that's going to be difficult to do, and we'll try to work around that as much as possible because the goal is obviously to compete as well as you can. But usually trying to ramp down the volume to calm those symptoms down. The second thing I look at is mobility, which is what we'll be talking about at CrossFit Rokius this coming Saturday. Assessing mobility, making sure you have sufficient mobility to get overhead. And then the last thing that I usually hammer on is rotator cuff strength. So the stronger your rotator cuff is, the better mechanics you're going to have reaching overhead and the easier it is for you to be able to do so. So what I wanted to do today was show you kind of a triple exercise set that I like to give for rotator cuff strengthening. It's worked really, really well clinically. It's great at completely fatiguing the rotator cuff, and it gets pretty good results. So if you're having shoulder impingement pain, give it a try, see if it helps you out. So I'm gonna move to the table that I set up over here and use a weight. So you're gonna be laying on your side with whatever arm has impingement on the top. You're gonna take a weight. This is a 4-pound dumbbell. That's more than sufficient. I recommend starting with a 1 or a 2 because this is actually a lot harder than it looks, especially if you have pain and your rotator cuff is kind of weak. So you're gonna start with your arm here, and then you're gonna simply bring it straight up, overhead, bring it on back down. You're gonna go back and forth here until you feel like you're working it pretty good and you're about, say, 60% tired. From here, next time you go out, you're gonna stop your arm directly out from your face. You're gonna bring it up to the ceiling and then back down. And then you're gonna continue here like this until your arm is about 80% tired. So back and forth, kind of right here. When you hit that 80% mark, you're gonna bring your elbow back to your side, rest it on your side, hand down to your stomach, and then you're gonna rotate up and down like this. And you're gonna continue here until your shoulder is completely exhausted, till you really feel like you can maybe do one more rep, but you're pretty tired. And even here, so this was a 4-pound dumbbell, and even with just doing what I was doing, my shoulders are already tired, and I consistently do rotator cuff work for my shoulders. So you really don't need a lot of weight to get a really good burn, and you wanna make sure you're going all the way to fatigue for this, and then you'll get the most benefit or the most bang for your buck. So quick recap, shoulder impingement, I look for 3 things. 1, increase or change in training volume. 2, mobility, and that's what we're gonna talk about this Saturday at CrossFit Rokius. We're gonna break down some of the common mobility limitations. So if you are free, 10 a.m., I highly suggest you join us. And last but not least, the rotator cuff strengthening I just showed you. So kind of a 3-pronged approach to dealing with shoulder impingement, and have a good night, everyone.